Today we're talking with KRMC's Chief Nursing Officer, Jim Wells, and Dr. Robert Matheny, Intensivist and Medical Director of KRMC's ICU. We'll start with Jim, who's going to give us today's COVID update numbers. Go ahead, Jim.
Thanks, Julia. I wanted to go over our numbers for today, Tuesday, July 21st. We've had 5,392 people tested. 4,856 are negative. We have 193 pending results and 343 positives. That gives us a 6.6 positive rate for COVID. Today in the hospital, we have 18 positive patients with 3 rule-outs, and our ICU census is 11. I also want to talk a little bit about an email that we received from our CEO that's titled Living Our Mission. KRMC's mission statement is serving our community with compassion and commitment. This letter was sent in by one of our patients' husbands to one of the social media sites here in town. And it says, "Kudos to the KRMC staff. My wife was recently admitted due to COVID-19 virus. I took her to the emergency department as she was very weak and dehydrated. She was admitted to 3 North for her condition. While it was very hard to be separated, we did understand the need. The staff was tremendous with their professionalism, compassion, and assistance. Even though I could not see my wife, I was able to talk to her daily. Without fail, the nurses on 3 North gave me daily updates. Her care team cannot be thanked enough. I want to thank all at KRMC. You guys are heroes." So I want to thank the gentleman that sent this in, and certainly want to thank our staff for the excellent work that we gave to his wife. This is something that we have tried to do with the isolation patients having visitor restrictions at the hospital, as we have set up a daily opportunity for families to try and communicate either with their loved ones if able, or with the nursing or physician staff. That's a little way that we can give some peace and comfort to those that have loved ones in isolation.
Thank you, Jim. Next, we're going to head up to our Cardiovascular Intensive Care Unit, or CVICU, and talk with Dr. Robert Matheny about convalescent plasma.
Anytime somebody gets an infection, whatever it is, our body's immune system responds to it, and it makes antibodies that help our body fight that infection. In the case of COVID-19, that also happens. Someone who gets the infection, their immune system will immediately respond to that and begin to create these antibodies. It was determined that if we could isolate those antibodies from somebody who's already gotten a COVID-19 infection, that we could then use those antibodies, give them to a patient who's actively infected, and let those antibodies work on that current infection. So that's the science behind it. Antibodies, when they are made, are stored in a part of the blood that we call the plasma. So convalescent plasma just means plasma from a patient who has recovered from COVID-19, and it should contain those antibodies, which we hope helps that patient to recover more quickly from their disease. Obviously, now that the COVID-19 pandemic has kind of been with us for a while, we have a lot of patients, obviously, who have recovered and who have that antibody stored in their blood. So in our case, we have become part of a larger trial involving multiple institutions where we are able to get access to that plasma. And so when we identify a patient who's early on in the infection and we think can benefit from it, we can submit the information from that patient and receive a dose of that plasma to give to that patient. Very good question. And until recently, we haven't had a lot of capability to do that. But as of recently, we are going to ramp up the ability to receive donated blood here in Kingman. In fact, I believe that there's a blood drive coming next month. Through our Care Anywhere line here at Kingman Regional Medical Center, we've identified and have track of a lot of patients, especially patients out in the community who have had the COVID infection. It's my understanding that those patients are going to be contacted and given the opportunity to come into a local blood drive and donate their plasma. I've also been led to understand that as we do that, we're going to get credit as a community and as an institution for those patients who have donated. So it's going to enable us to have quicker and easier access to more plasma as we get infected patients. Obviously, we don't want to take blood from patients who have an active infection. So we need you to have completely recovered from your COVID disease. And that usually is anywhere from a 2 to 3 week time period. So we want you to have been without symptoms for at least 14 days. And then for your body to form the antibodies that we're interested in getting, we probably need a period of about probably a month. Antibodies form kind of very acutely with the disease, and then a more stable, longer acting antibody forms, after about 3 weeks. So I would say probably to be safe, a month or so after you recover from your active infection. Obviously, with COVID-19, the mechanisms to treat it have, there's been a lot of speculation, a lot of things have been talked about on the news, and you've heard about a lot of drugs and a lot of different therapies. I do want to let you know that the convalescent plasma has been well studied, and it looks like it's having a good effect. We've got pretty good, well-vetted and peer-reviewed data that shows that it works. I will also say that anecdotally here in Kingman, we've probably given almost 30 doses of this drug, and from our standpoint in the ICU, it appears to have had a very positive effect on our patient population. We're very pleased with the results that we've had giving that therapy here in Kingman.
Thank you for watching our COVID-19 video series. Follow Kingman Regional Medical Center on Facebook for updates. And for more information about our COVID-19 response, visit our website at azkrmc.com/COVID-19. Don't forget, we have a blood drive coming up on August 19th and 20th at Beals Celebrations downtown. Thank you for watching, and stay safe and healthy until next time.